Good morning and welcome to the California Collaborative for Long-Term Services and Supports monthly webinar. So happy to have you all here today. We have a very timely agenda where we're going to talk about the May revision to the governor's budget, and we have a great panel of folks here to share a lot of their insights about what is happening in the long-term services and support space and some of the investments that have been proposed in the budget, as well as some of the items that may still be missing or require additional attention from the governor and the legislature. We do encourage you to engage in this conversation. We have the Q&A feature open. So if you think of items along the way, please do type them into the Q&A and we will monitor that and make sure to address those questions and responses and issues as we go through. You also have the ability to raise your hand and then we can unmute your mic and you can share your thoughts. So please do look forward to the Q&A discussion part at the end, where you'll have the opportunity to share any items that maybe weren't addressed by our panelists or share additional thoughts and resources with the group that you think may be helpful as we move into finalizing the budget next month. So I will go ahead and kick this off by starting with Sarah Steenhausen from the SCAM Foundation, where she's the Director of Policy and Advocacy. And she's just going to give a quick overview of the California May revision and a look at the proposals that impact older adults and people with disabilities. So Sarah, I will pass it off to you.
Great. Well, thank you so much, Athena. It's great to be here. I hope everybody's doing well. So yes, I will be covering kind of a high-level overview for context of what's in the May revision and some of the key themes, and looking forward to hearing from our esteemed group of panelists who will expand upon and kind of dissect the different areas and discuss strategy related to it. Next slide. So we all know that really surprising year this year with a $75.7 billion surplus as a result of both federal resources for COVID relief, but also related to an improved fiscal picture that was it's stark contrast to the 30 plus or however many billion dollars budget deficit that we faced at this time last year. Next slide. So this, I would say the focus of the budget in general responds to, as we all know, the COVID-19 pandemic, the fallout from COVID related to just disparities in healthcare access and racial inequities and structural issues that need to be addressed, as well as the desire to focus on economic recovery for Californians. Next slide. So I'm going to focus on some of the key investments, but before we get started, next slide. I wanted to just highlight a poll was released right before May Revise, where 1,000 voters were polled in California of all ages, representing different regions of California, Republican, Democrat. And what was interesting is that overwhelmingly, voters said that, yes, COVID-19 does create a lot of urgency to prioritize California's master plan for aging. So as an example, you know, they expect the governor to prioritize invest in the master plan. Almost 80% of respondents said that. Almost 90% of those polled said it's really important to have access to services needed to live at home in the community. So I think this just underscores the system transformation efforts that we're seeing that really do and will resonate with voters. Next slide. Some of the key budget themes that were called out in the Health and Human Services component of the budget were transforming the behavioral health system for children and youth, supporting our homeless population, and then of course, number 3, we were happy to see the focus on building an age-friendly state for older adults and people with disabilities, innovating and advancing our Medi-Cal program through CalAIM, transforming our public health delivery system, and focusing on providing care to our most marginalized. Next slide. So I'm going to review the different buckets of investments. I'm not going to go through line item by line item, but I just wanted to give you an overview of the different health and LTSS programs, and there's another slide after this as well. In terms of This slide outlines what was invested in the proposed budget, but then also what is called for in the May revision. And in terms of new investments in health for May revision, the Department of Healthcare Services is placing a lot of emphasis on population health management. So that's providing kind of a wraparound services and data integration to defined populations. So this includes dual eligible individuals as well as children and adults. And I think it will enable the state to better target and serve people by population. But I think importantly in the May revision, if you can see the second to last line here, outlines the expansion of Medi-Cal to adults who are 60 and older, who are undocumented. This is really significant, and it was a big win for this community. We also see more investments in our geriatric workforce, with expanding upon what was introduced in the January budget by $5 million for a proposed $8 million investment for OSHPD to work on advancing the geriatric workforce. And then, as was proposed in January, investments in telehealth, making permanent some certain flexibilities that were established in COVID, but also moving forward with the CalAIM initiative. Also, I just wanted to note that previously there was a suspension of Medi-Cal optional benefits. That has been repealed permanently. So that is included, and those include services like audiology and speech therapy and others. Next slide. Other investments in the health arena, the community-based adult services, this investment is really more for the state level staff at to oversee the certification of the CBAS program. You'll see that there's a new investment in the May revise for incentivizing and funding career paths for IHSS providers. This is a really important initiative to meet the workforce needs for direct care workers. There's an effort to modernize our health insurance counseling and advocacy program, which provides key education and advocacy for people on Medicare, as well as a new office of long-term care patient representative, which will be at the Department of Aging. And this is really critical because there are residents of SNFs and ICFs who do not have the capacity to make their own decisions. And this would provide a legally authorized decision maker for these individuals so that they are not essentially left without anybody speaking on their behalf. Next slide. I know Sawait from Disability Rights California will talk more about the IHSS investments, but really significant investments. First and foremost, eliminating the 7% across the board reduction for almost $250 million in the 22-23 year, and almost $500 million GF ongoing. Also making permanent the IHSS backup provider system, and that's really critical so that people can access caregivers and avoid disruptions in care due to times of emergency. There's also provisions in the budget to maintain the state-county ratio for the non-federal share of costs that counties would have to pay for amidst increases in minimum wage. So essentially what this does is it supports counties in paying for IHSS when there are increases in minimum wage so that they don't have a disincentive to increase minimum wage for the IHSS workers. Next slide. There is about $106 million dedicated to what's being called the Older Adult Recovery and Resiliency Fund at the Department of Aging. This provides one-time funds to really respond to the healthcare needs that older adults, people with disabilities have in light of COVID response, and helping them re-engage and be supported at home in the community. So there's a number of different investments, and these are all listed on the Department of Aging's budget proposal, or sorry, May revision summary, but everything from looking at behavioral health needs through a call center, addressing the digital divide, looking at expanding employment opportunities, expanding access to home delivered meals, as well as fall prevention, family caregiving, and expanding resources for the Aging and Disability Resource Connection Program. Next slide. There's also a very strong emphasis on Alzheimer's disease. In the proposed budget, provided resources for Alzheimer's disease provider training, as well as research, a brain health campaign, caregiver training, as well as dementia-friendly communities. What was exciting is that in the May revision, there were additional funds committed to this. So for example, the brain health campaign was doubled from 5 million to 10 million. The provider training, provider training and developing standards of care was also more than doubled from $2 to $4.5 million. And I know that Jed will talk more about that as well. Next slide. And also there was an emphasis on health equity. As I said, this was a theme throughout the budget, and I think is also a theme throughout the master plan for aging. But in specific, I think it's important to call out that the Health and Human Services Agency will be kind of doing a broad-based analysis to look at COVID, health disparities, and health equity to inform how they might respond to any such future emergency to ensure that they have an equitable response and are prepared. They're also looking at expanding access to services and looking at improving and delivering language access, which is really critical, of course, for our diverse aging population and people with disabilities. Next slide. There's a number of investments in housing and services for those who are homeless. As we know, this is one of the biggest needs facing our population, with increase in the number of older adults who are facing homelessness. So we have an expansion of they're calling it the Community Care Expansion Program, which will acquire and rehabilitate small board and care facilities so that we can house more of the homeless population and low-income older adults. The investment into that went from $250 million in the proposed budget to $500 million for 21-22, and another $500 million for the following budget year. So that's $1 billion that will be placed into expanding these options for people either homeless or at risk of. There's new investments in the Housing and Disability Advocacy Program so that people who are homeless can get access to important benefits. A really significant investment of $100 million into the Home Safe program, which is for the Adult Protective Services program to assist their clients with meeting their health and safety and housing support needs for those who are at risk of or currently homeless. It also provides supportive, the budget provides new funds for supportive services for those who are formerly homeless. And it also makes a $150 million investment into the Project Room Key program so that those homeless individuals who were living in hotels can transition to permanent housing. Next slide. And then there's a number of important investments for economic security and food access. Finally, this year, we've seen an increase in the Supplemental Security Income SSP COLA. We haven't had a COLA for several years. I know that there's a desire to see it increase, and I'm sure that our panelists will talk about what to do to continue to assist low-income older adults and people with disabilities with income support. And then also expansion of outreach for CalFresh and supporting our food banks and helping in other food assistance programs so that we can ensure that older adults and those who are vulnerable can access the food that they need. Next slide. And then finally, we've all talked about the importance of state leadership in overseeing not just the master plan for aging, but also other initiatives that are critical for system change. So we're all still waiting for the appointment of a senior advisor on aging, disability, and Alzheimer's to be placed in the governor's office. We haven't yet heard when that will happen in particular, but it should happen sometime this summer. That was referenced in the budget. Also, the establishment of the Medicare Innovation and Integration Office. And the May revision kind of provided the more detail through their proposal and what it would do to explore opportunities to better integrate and innovate both the Medicare-only population as well as the dual eligible individuals. The budget also provides resources for master plan implementation. And there was some specificity given to what was previously a placeholder in the January budget. The May revision builds it out and outlines 20 permanent positions with the Department of Aging to oversee implementation of the master plan. And finally, there's resources in the May revision for the Health and Human Services Agency to lead on information exchange efforts for both health and social services. So as we know, the budget is supposed to be approved by the legislature by June 15th and signed by July 1st of 2021. I did want to flag that we've all been waiting for information on a provision of the Federal American Rescue Plan that enables states to receive an increase of 10% in what's called the federal Medicaid assistance percentage. This is really critical because essentially it will provide about $2 billion to California specifically for Medicaid home and community-based services. So the state guidance was just released like the day before May revision. So we're still waiting to find out what will happen with those funds. And it needs to be, I think, resolved by the time the budget is passed. So just keep a lookout for that, because I think we all were looking for, hopeful for additional investments in particular to address the infrastructure of our home and community-based service delivery system. So with that, I will turn it back over to you, Athena.
Great, thank you so much for that high-level overview. So as you can see here, I have the honor of introducing a great panel who's going to each give a couple of minutes on their own perspective on some of the important things to highlight in the budget, since there's a lot in there. So we will hear first from Karen Keeslar, who's the Executive Director at the California Association of Public Authorities. We will then hear from Sawait Seyoum, who is Senior Legislative Advocate for Disability Rights California, and then Anwar Zouehid, who's the Vice President of Long-Term Services and Supports at Partners in Care Foundation, and then Giarusso, who's Government Affairs Director of the Alzheimer's Association, and Claire Ramsey, the Senior Staff Attorney for Justice and Aging. So that's going to be our panel. I will pop in and introduce each one again as they come on, but we'll go ahead and hand it off to Karen to kick off this great panel. And please remember to type your questions into the Q&A or raise your hand so we can get to those after this panel. Karen.
Good morning. We're all going to be speaking through our items pretty fast because the time is limited and we really want to provide some time for questions and dialogue. So I'm just going to enhance some of the things that Sarah had touched on with IHSS. We're really thrilled that the governor is proposing to repeal the 7% cut in IHSS permanently. There's no language issues. There's no controversy. That's something that is going to be done. On the state-county sharing ratio, this is really important because it's the foundation of the funding for counties to collectively bargain with the unions. We're very close, but there still are outstanding issues there. There's still language issues on the trailer bill. Also, the unions are proposing a penalty for counties that to incentivize counties to reach collective bargaining agreements. Those things are still being discussed. The governor's budget in January proposed an auto termination for IHSS consumers that don't complete their Medi-Cal redetermination in a timely manner. And so the computer would be programmed and has been programmed to automatically then terminate them from IHSS. There's a broad coalition in support. We're pushing for that to be defeated. As Sarah said, the May Revised is proposing a brand new permanent backup system. The budget provides approximately $12 million for that. It contemplates counties and public authorities using either the individual provider mode or the contract mode or a blend of the two. The biggest problem right now is that the May Revised only provides $190,000 statewide for all counties and public authorities and their administrative activities, which is like getting the calls from consumers, getting a provider out to their home, screening providers. $190,000 is absurd. We're working very hard on that. As Sarah said also, the governor's budget proposes $200 million to be spent over a period of time for long-term care career pathways. There's not a lot of detail to this proposal at all. The state is describing this as something that would be that would evolve after stakeholder conversations, but there are definitely groups that are proposing things that are put more specificity into that. So I expect that we'll see that evolve more than what the May Revise said. Finally, on the electronic visit verification, I think if you skip down a couple of slides, on electronic visit verification, there was a broad coalition a few years ago that got language in statute to create guardrails or protections for consumers and providers. And one of the most important is a prohibition for our state to never use GPS or geo-tracking in the EVV system. This administration, state administration, is saying that the new federal administration is insisting that our state have GPS, some kind of location tracking. We don't believe that those conversations should be concluded. The Biden administration's only been in office for 4 years. So there's, again, a coalition that has submitted letters and is talking to members of the legislature and in the administration, urging that that be dropped and that there be more conversations with the Biden administration before we give up on that. So that's my list. Thank you.
Great, thanks so much, Karen. It's kind of like speed dating here, so we'll jump right on in. So Sawait, you're up next.
Great. Can you all hear me okay?
Yep.
Great. Thank you, Karen. So I think, you know, I will just take this opportunity to talk about some of the DD related proposals. Many of the IHSS related proposals that Karen talked about, we are very much aligned, whether it's the electronic visit verification trailer bill or the IHSS backup providers, the 7% cut. We're just elated to hear that finally, you know, here in 2021, that those cuts are going to be permanently repealed. And so I just want to echo that. You know, the May Revise for, and I should introduce myself, I apologize. Sawait Seyoum for Disability Rights California. You know, we believe that the May Revise really represents a historic level of investment in the system serving Californians with intellectual and developmental disabilities. Among the most notable proposals from the Department of Developmental Services are $4 million for the establishment of a statewide work group to develop a system of providing performance incentives to regional centers based on meeting certain performance measures. $12.8 million for improving the capacity of regional centers to support individuals in exercising choice and self-determination over their own services through increased staffing, training, and supports. Also over $10 million for promoting innovation and increasing employment for people with disabilities and strengthening internship programs. Also over $17 million aimed at equity and improving access to the regional center system for the most underserved communities. Also over $23 million to provide provisional eligibility to children ages 3 and 4 who may not otherwise be eligible for regional center services under existing statutory criteria. DRC applauds the administration for these investments. At the same time, we have questions and seek additional details about many of the proposals. With regards to the COVID-19 response, we note, you know, as the impact of the pandemic has ebbed and flowed, we've seen some regional centers have taken the position that in-home supports and other services can be terminated without a notice of action. And we're asking that DDS would clarify that any termination or reduction of these supports and services are subject to the Lanterman Act. With regards to the self-determination implementation, you know, the administration released trailer bill language yesterday. And while we appreciate the additional funding for self-determination implementation, we're extremely disappointed with the TBL that was released. It introduces really a new statutory language that directly contradicts the core principle at the heart of self-determination. which is giving people with IDD the ability to decide what services and staff work best for them. And also with regards to the DDS proposals related to service access and equity, we believe that this represents a major investment in this area. We do think it's a step in the right direction. However, we do believe that more can be done to ensure that the investments reach the consumers and families most impacted by the structural inequities that exist in the system. And also, we know that while many of the proposals are well-intentioned, they lack the necessary scope or breadth to make a meaningful difference. For example, with regards to implicit bias training, we appreciate the administration's proposal to, in the recognition, of the value of such training, but there is limited to no detail about stakeholder engagement, how the trainings will be provided, or an evaluative component to determine whether these trainings achieve their intended purpose. And finally, I'll add, with regards to the DDS proposals related to employment, we support these efforts to address the job loss among disabled individuals during the COVID-19 pandemic. We are concerned, however, that there are no requirements that tie funding to outcomes and no evaluative component. We also don't oppose statutory changes to increase the number of incentive payments for longer term employment or to support internship development, but these surface level proposals do not address the structural reasons that lead to underutilization. And finally, we note that while these are significant investments that have been included in the May revise, there are proposals important to individuals with intellectual and developmental disabilities that are notably absent from the governor's budget. These include proposals to restore camp and social recreation as a regional center funded service, removing statutory language which prohibits adults who live with their families in intergenerational households from receiving the same type of support as adults who live on their own, removing of burdensome exhaustion requirements before a regional center can fund needed services, eliminating family fees and other family cost sharing programs, and also finally maintaining pandemic related flexibility that really increase consumer and family choice, expand options for meetings and service delivery using virtual meeting platforms. Thank you so much for the opportunity to share with you today.
Great, thank you so much. Lots of good information, some of the things that are missing and support for some of the investments. Anwar, I will hand it off to you.
Good morning, everyone. My name is Anwar Zouehid. I'm the Vice President of Long-Term Services and Supports, Partners in Care Foundation. And first, I'd like to start by saying how much I appreciate this proactive approach to dealing with our state's health needs. I don't remember or ever really remember seeing such an aggressive plan to address the healthcare disparities proactively rather than reactively. So I'll begin by addressing a few highlights and thoughts of the main revise, and that's first a much welcomed increased funding for residential care facilities for the elderly. Especially excited that it aligns to address the homeless for our older adults. Second is a continuation of the very successful Dignity at Home Fall Prevention Program, part of the leading cause for ER hospital and SNF placements. And I think that would definitely help overall interventions for our state. Additional funding to avoid disruption to caregiving. This is really key. It's one of the many causes of long-term SNF placement that I believe that this would help address to avoid. And an expansion of Medi-Cal to undocumented older adults ages 60 plus. I can't say how many times I've seen countless times when we were not able to enroll a person due to their immigration status, and only to see them end up in a more costly institutional care setting, which of course ends up costing us costing us more money. I'm hopeful that this increase will increase the overall health outcomes of our communities and avoid more costly reactive emergency care to reduce costs. And finally, welcomed the overall increase in staff funding for the Department of Healthcare Services and the Department of Aging and other of our state colleagues. This will definitely help improve the innovation throughout our state, help with retention and continuity, improve overall quality of care and outcomes, and improve model of care oversight, and really welcome the more program level involvement and oversight by the state. I believe success comes from a high touch care coordination relationship between the state. I've seen many programs that had low touch, but I can see with our bigger programs where the state is highly involved, we have so much better outcomes when it comes to that care coordinating. And of course, leads to improved overall service delivery for our programs and yield a much better outcome. So these are my key highlights of the May revise. And I think, again, I want to reiterate how much of a proactive approach this May revise gives. And I don't think I've ever seen it. And I'm really hopeful that that this proactive approach will help lead for a better, healthier California. Thank you.
Great, thank you so much. Lots of additional insights there. Jared?
Good morning, everyone. My name is Jared Giarusso, Government Affairs Director for the Alzheimer's Association. I'll start by saying that our tone around the May revise broadly is a yes and tone. So much has already been mentioned. Many items have already been mentioned that we're supportive of: Medi-Cal for undocumented seniors, the older adults recovery and resiliency funding, the Office of Medicare Innovation and Integration, and the Senior Advisor on Aging, Disability, and Alzheimer's are all things that we're very excited about. When it comes to Alzheimer's specific funding, it's the most that we've ever seen in a state budget. So we're extremely excited about that. And each of these proposals advance not only the state's master plan for aging, but also the Alzheimer's Prevention and Preparedness Task Force, which occurred concurrently last year. So running down the items, we saw, as Sarah mentioned, in addition to the public education funding from 5 to 10 million, which has been a priority for us for years. It's focused on at-risk populations who are disproportionately impacted by Alzheimer's. The design should be culturally competent and equity targeted, and should inform folks on risk reduction, the differences between normal aging and dementia, and hopefully drive people towards existing resources. The caregiver training is something that we saw in the January proposal from a year ago, which has the Alzheimer's disease, the California Alzheimer's Disease Centers, of which there are 10, design a training program for caregivers. We're the 4.5 million, now 4.5 million in standards of care is something that we're really excited about and has been a priority for us in this legislative cycle. And last, a portion of that will also go to the centers to help connect the centers to physicians and caregivers to help them utilize best practices in the field, as well as a portion of this to pursue quality initiatives for within managed care plans. 2 million on dementia-friendly communities, which is also the Blue Zone challenge. These should be grants to cities and health jurisdictions. The 6 million on geriatric work, or 8 million, sorry, on geriatric, or 8 million, I think I had a typo there, on geriatric workforce incentives, something that we're really excited about in how it relates to timely access to timely diagnosis of Alzheimer's and dementia. And then the research funding, where we're excited to see what the state can produce that gives us a better sense of the impacts, the disproportionate impacts to different communities. Our biggest priority this year is through our sponsored bill with Senator Monique Limon, SB 48, which is around access to timely diagnosis. Less than half of individuals living with Alzheimer's and dementia have been diagnosed, and so that's a foundational issue that we're trying to address. The bill, as it stands, is a medical education bill that requires no funding, but as we've been working with stakeholders within and outside of the legislature, there might be an addition to the bill, which is modeled after the work being done around adverse childhood experiences, or ACEs, where we would create incentives for physicians to administer cognitive screenings for seniors in the Medi-Cal program. So again, broadly speaking, this has been a great budget for us. It advances work that is very important to us, but we do remain committed to seeing if there are other opportunities in this mad dash to the finish line.
Great, thank you so much. Lots in there, always a little bit of good and a little bit of bad. So good to hear about that tempered approach and some of your priority items. So thank you, Jared. And then last but not least, we will have Claire Ramsey.
Thanks, Athena, and thanks everyone. Glad to be here today. I think I'll just build on a few things. So much has been said already, and Sarah did a great job doing that huge overview of all the things. And I guess I would just start by saying, this really does feel like an unprecedented investment in older adults and people with disabilities. One that I think we were really hoping would materialize from all the work on the Alzheimer's Task Force and the Master Plan for Aging work, but did not happen, out of nowhere and just by chance. People really advocated and worked to engage the administration around this. So it was really nice to see that pay off. And to Jared's point, I think the yes and is so important. And I think we can blow that up both to this year and to ongoing years, really seeing this as a down payment on a 10-year plan that we've all worked so hard on. And so we just don't feel like, oh, just this year is sort of like an explosion of money and then we don't see anything else going forward, or very, kind of back to the smaller levels that we normally saw invested. I just want to mention a couple things about housing that maybe aren't as much on people's radars because they're a little tangential to some of the direct investments around older adults. But I just wanted to mention that Project Home Key, not to be confused with Project Room Key, but Project Home Key, which is permanent housing, there's a $2.75 billion investment in continuing that program and in acquiring permanent housing for people. So I think that represents a really large opportunity. Of course, not all of that housing is for older adults and people with disabilities, but I think there's a good area where we can continue to push and make sure that those needs, the people's needs, are met in that housing, and that there's a chance for people to have accessible housing and to be part of that program. There's been a program for the last number of years called the Housing and Disability Assistance Program, HDAP. And that program helps transition people from general assistance onto the SSI program. And often these are individuals who are under 65 with significant mental health disabilities who are struggling to get access to SSI. That program is going to get $175 million to continue its work, which is hugely important because it's such a hard process to get onto SSI. There's also $20 million in eviction defense for legal services to support people so they can stay housed. And then I'll just mention in the older adults recovery and resiliency package that Sarah mentioned, people should really take a little longer look at all the different components of that. Again, I think this really represents like a good down payment on investments in all these different areas that really need this investment, but are not going to sustain us forevermore. So just really thinking about how we can continue to work and expand those things. I'll just mention briefly, there's a couple things for us that aren't there that seem really important to push on. And the first is that SSP increase. So this is the state portion of the SSI grant. It might be a little confusing, but the state is doing a COLA increase. It's about a 6% increase in the grants to $171 a month, which is added to this federal portion of the SSI grant so that people's total amount will go up. They mentioned it's going back to the 2011 number. Just a reminder to people, actually the 2009 number was the number we're shooting for because it kept getting cut in the recession, in the last recession. And so actually the 2009 number is where we're shooting to go back to, which would basically be 100, getting people up to 100% of poverty. And then the other big thing that we are pushing for is the elimination of the Medi-Cal asset limit, Right now, that limit is $2,000 for an individual and $3,000 for a couple. We were really excited to see that the Assembly has put that in their budget priorities, a full elimination. The Senate reformed the asset test. So they were a little less clear, but they also made it a priority. Didn't come out in the governor's budget, but it's something that is actively getting pushed on. And the bill that supports that ask also got out of appropriations yesterday. So we have a lot of hope and resolve to keep pushing on this to get it done this year. And I think I'll just close by saying, I just want to thank everyone, because honestly, the community here and the larger community has really worked so hard to get here. So I really feel like I hope people are really seeing the fruits of their labor and seeing that when, the administration needs to want to do some of this stuff, right? It's not just about us speaking up, but when they have some will and we keep pushing them and working, we can really see tangible results. So I just thank everybody for their advocacy, and that we'll keep working on all this and keep pushing to make things better for everyone across the state. Thanks.
Thank you, Claire, and the rest of the panel. Really appreciate all those insights. I'll just note that, with a budget, a state as big as California, even in this slice we're looking at related to LTSS, there's a lot of stuff going on, even in this space. And so I encourage you, during the members section, which we'll talk about next, if you have issues that didn't get raised, even with all of those perspectives, please do. We encourage you to reach out and for those members of the collaborative to share with the collaborative. We have heard that they are making decisions this week. So I'm going to hand it back to Karen quickly for a call to action, since she's a member of the collaborative board, and we wanted to encourage folks to engage the collaborative.
I really want to encourage people to move as quickly as they can to communicate their issues to the budget subcommittees, to the members of the legislature, and to the administration. When I say things are moving quickly, it's really unbelievably fast. The May revise came out on Friday the 14th, and the first May revise hearing was Monday the 17th, like 3 days later, with preparation over the weekend. So this last week has been budget subcommittee hearings every day, but today, next week is the final budget subcommittees meetings on all the different May revise. So Monday, the 24th is a Senate sub 3. Both Assembly and Senate budget subcommittees are meeting on the 26th, and then they go immediately Thursday of next week, the 27th, to full Assembly budget committee. Senate budget full committee is Friday, the 28th. The following week is when the budget full committees will finish their actions. There could or could not be a conference committee. I don't think that's 100% clear. There's usually a few issues that the two houses need to resolve and work out in the conference committee. But my point here is that you need to be communicating now to the people who are involved in your issue, the budget subcommittee staff, the members of the legislature, the administration. Don't hesitate to email people at the top, because they are, dealing with the things that are the important issues and need to be closed. And they are making decisions literally every day, and big decisions will close out next week.
Okay, great. So call to action, and of course, for collaborative members, you have additional issues that didn't get raised, but you need sign-on letters, you can use the listserv to make sure you get member support. So quickly, I'm just going to run through some of the questions we're seeing in the chat. Some have been answered. So thank you to our panelists for multitasking and answering questions while also providing this great information. So there's some comments in support of the Lanterman Act, still being really important for older adults and people with severe disabilities, so making sure we support that. There's a question about language specifically in the trailer bill that goes against self-direction that was noted. So if anybody has a link to that or resources on where that is, so that folks can advocate to have that clarified or changed, because of course, very important to continue that self-direction for recipients of the care. There's some support for continuing conversations with the Biden administration around the GPS and not implementing that in California. So I think that's also one of the questions that was answered in the chat. Lots of comments about training for IHSS recipients and training for providers. and increasing the help that we give to the IHSS program. There's some questions about providing backup care, and I know there's some investments there, but probably some more clarifications and work to be done. So really important to do that. And then we do have not a question, but a support. Remember to not forget about Caregiver Resource Center budget requests and stabilizing their funding. So please, if you support that, reach out and contact your legislators about the funding for Caregiver Resource Centers. There's support for the COLA increase that Sarah talked about. And then some other comments about housing, lots of investments in housing. But more work to be done for sure. Then there's some questions about the slides, and there will be a recording made available, and the SCAM Foundation is working on a summary. So the recording and some of the slides will be made available, and then of course we'll share out anything that the SCAM Foundation does as it becomes more, as it becomes available. So I think that's kind of the summary of folks. I do have some hands raised. So I'm going to start with Greg Thompson. You have your hand raised. Maria will go ahead and unmute your line.
Hi, good morning. I'm very excited and optimistic about all of the new funding for home and community-based services. And I'm also cognizant that there are many programs and unmet needs. And I feel it's important also to acknowledge the great work that's been done by the governor's master plan on aging and all the many advocates throughout the state of California. And I especially appreciate this collaborative for hosting these webinars and giving us an opportunity to respond to the valuable information you're providing. I just have a comment that's directed specifically to improving the IHSS program. And that is that once we have a final budget and we understand the figures and the dollar amounts that will be going towards the IHSS program, I recommend that we look at how that funding is divided. Quite simply, it's been my experience that the overwhelming majority of the funding goes to the gatekeeping or the administrative part of IHSS. It's important to sign up the right people and make sure that it's run appropriately, but all the gaps seem to be on the direct services side of the program. Consumers having trouble finding providers, providers needing training. So I just encourage the policymakers to kind of look at how we divide the funding up and maybe get more of the dollars towards the direct services part of it. Naturally, I'm leaning towards the public authorities, but there are many services that help consumers find providers and providers who need resources as well. So thank you very much for taking my comment.
Yeah, thank you. We appreciate that. Karen, you got a follow-up?
Sure. To Greg's point, the IHSS budget is just under $17 billion. And of the $17 billion, just under $700 million is the admin for the state, the counties, and the public authorities. So I'm not exactly sure what Greg's saying about not enough money going to services, but out of a $17 billion IHSS budget, only $700 million is the amount that is for admin. I've had some emails that came in asking about the how to weigh in on opposition on the EVV, about the GPS tracking. That was a lot of acronyms. So I'll be sending out a sign-on letter here within the hour. I know the collaborative has a process in order for the collaborative itself, but certainly encourage other organizations to sign on, and I'll give you till Monday morning and then get that out to all the right decision makers in the Capitol. The last thing I want to say is I've seen comments in the chat about the emergency backup services and how that would work. So there's a lot of questions on that. The state has described that as a service that would be available to any consumer who has an immediate health or safety threat, but they've only budgeted $12 million total for all of that, and only $190,000 is for admin. So I don't know how we're possibly going to be reacting statewide to help consumers who are in immediate need of a backup worker with only $190,000. As a comparison, San Francisco has a contract with an agency that helps for those essential and emergency cases, and they spend $27 million on their contract. That's what's in their budget for 21-22, and this $12 million for the whole state. So there's a lot of work to be done, and I'm sure it's not going to meet the expectations that people have, and we certainly need help to have enough admin money to be able to respond to consumers who need help.
Great, thank you, Karen. So it looks like we have Randy. Do you have your hand up? I know you wanted to share something about C4.
Yeah, I wanted to talk
SSI.
about the SSI, the CA for SSI coalition, and what we're trying to do is, you know, way back 2000, 2008, you know, we were in a massive recession. And what they did was they eliminated the cost of living adjustment, which for the state supplemental plan program. We realized there's a letter out too that's been sent out to the legislator and to people to sign on to. And what we realized was that even though if they don't give us a raise, I don't see how people are going to make it. Because the fact is, even though there's been stimulus money coming through, but a lot of people are spending that stimulus money so they can catch up for the raise they didn't have. And so we're continuing to push for the CA for SSI raise. We got to get it back up to the level it was in 2008, pre-recession levels. We know people who are having a hard time, even with programs that are out there to help them, they're still having a hard time eating a rent and things like that. And some people weren't eligible for some programs, and some people are homeless. And we need a CA for SSI raise. We really do. We need to push this. And there's a letter out, and we'll send you a letter because we have a letter already going out to the legislator. We know that one legislator has already put in the budget negotiation for it on one side of the House. We're hoping that the other side of the House will do it too. And we did not see it in the May revise. So we're going to continue to push for this because people need this. It's really going to be difficult. I mean, I know some people who are, you know, just because they got CalFresh doesn't cover it if they have more people that didn't have food. And there's a lot of folks who have been having rent issues and all of this stuff that's going to be going on. And we should go back to the old rate anyway. We should go back to the pre-recession rate. And so that's what we want. That's what we're looking for. And anything that you guys can do to help or talk to the governor's office to do this, and we're really happy to help you. And you can go to our website at caforssi.org, C, capital A, or SSI.org, and you will see our petition there. You can sign our petition. You can send our petition around. Thank you.
Thanks, Randy. Appreciate that, and definitely support for that coming in through the chat, and I'm sure for folks. So great opportunity. So in our last, few minutes here, I do want us to shift a little bit to the member sharing. And so please, as a reminder, you can use collaborative members may use the listserv if there's items that we didn't get to talk about today or that are priorities. And as we noted, things are moving quickly. We also just wanted to highlight that the collaborative did have a budget proposal to fund some staff positions at the Department of Healthcare Services in order to increase data transparency. And we were excited that the funding request actually got doubled through the process to fund additional positions and is moving through the process. So hopefully have more availability of data for LTSS services being provided to both those dually eligible and those that are seniors and persons with disabilities. So excited to see that moving forward, and wanted to make a little plug for the collaborative's first budget request. We also supported a $400 billion investment in Medicaid from the federal government. The collaborative did sign on to a letter that was circulated by Justice and Aging to support that investment, which of course supplements a lot of the American Rescue Plan funding and some of the recent guidance that we've received around how some of that money can be spent, including the 10% increased federal match for HCBS services. So lots of activities happening. Really excited to hear that. So if other collaborative members have thoughts or items that we haven't touched on, we do have a few more minutes here. So we'll open it up. Please raise your hand. I do see that Connie has her hand up, so we'll go ahead and open up the line for Connie to share anything that has priorities that haven't been discussed yet. Connie, it looks like maybe you're muted on your end.
Oh, can you hear me now?
There you go.
Well, I have to say that this year I feel disappointed still in the budget for programs related to issues related to IHSS. And I'm hoping to see something different in the future, but it's very critical to differentiate the pay for providers who are willing to work for those with severe impairments. I'm talking over 196 hours or those that have maximum IHSS hours and maybe a waiver. And we're only talking about a smaller portion of the 28% that are reliant on non-relative community care providers. So I would hope that addressed here in the future, and the backup services are critical, but the training issue is not about big training programs, you know, by some organization coming in and training people. It's about people with disabilities being able to have their own training budget and be able to pay their existing provider to train a new provider, because that is going on, and that's something that is going to definitely be impacted by the EVV issue. So I just raised that up. And on the housing issue, there is nothing requiring roll-in showers in any fast-track housing, only accessible tubs. And the idea that people that are low income or very low income, which are much lower than what is the income qualification for affordable housing, are going to be denied access to bathing facilities is wrong. So something needs to happen to have a legislator sponsor a bill requiring, you know, a larger portion of housing to have roll-in showers.
Yeah.
Thank you.
Thank you very much. Yes, the devil is in the details for sure on all of these things. So it's been really great. I want to thank all of our panelists and also Sarah from the SCAM Foundation for all of the great insights and oversight and what is a big budget that's moving quickly. And so we really appreciate everybody sharing their thoughts. I know you're all very busy working on behalf of your own organizations. So we look forward to seeing what happens in the next couple of weeks. The collaborative will share out again a recording of this webinar and any additional resources that come our way that we think will be useful. But with that, we have reached the end of our public webinar for this month. We look forward to seeing you next month, and we just really appreciate your continued support and attendance. Have a great weekend, everybody.